Oh, okay, let me start the timer.
Okay.
So 1, 2, 3, and start.
Hello, I am Dr. Abdulhamid, one of the doctors in the gut clinic. I'd like to confirm that you are Mr. Peter, 57 years old.
Yes, doctor, I am Peter and I am 57 years of age.
Mr. Peter, I am here to discuss with you an issue related to the health condition. Is that okay for you?
Yes, sure, doctor, that's why I'm here.
Yes. Before we start, do you want anyone to attend with us this meeting?
No.
Okay. And how do you feel now, Mr. Peter?
Well, doctor, I feel sick. I feel tired and sick because I was in a very bad health condition.
Yes.
But I'm not throwing up blood now, but I'm not feeling good. I'm feeling weak.
Yes, I am so sorry for that. And how much have you been told about your condition, or do you understand about your condition?
No, doctor, nobody told me. I just came to the emergency department and I was throwing up blood. So there was no time, I think, but everybody was rushing. So nobody told me more.
Yes, yes, yes. And do you have any expectation, Mr. Peter?
Yes, doctor, I am expecting that you will now give me uh, leave from the hospital and I will go home.
Yes, yes, yes. I appreciate your words. Mr. Peter, can I explain to you more about your condition, if you don't mind?
Yeah, sure. That is why I'm here.
Yes, as you told me, Mr. Peter, you have brought to our hospital in the emergency department as you have complained of bleeding and throwing up from blood. And in the best of interest of your condition, we have performed a camera test for you. And fortunately, we have stopped this bleeding.
Mhm.
Are you following me, Mr. Peter?
Yes, yes, doctor, I'm getting you. Yes.
Yes, yes. What I want to tell you is that this bleeding is a complication for a condition that you have for a long time, since 1 year, called Barrett esophagus. Have you heard about this before?
Yes, doctor, I have heard this. Last time when they did camera test for me, they told me that I have this esophagus. Yes, you're right.
Yes, yes. And how much do you understand about Barrett esophagus and the reflux disease?
I don't understand more, but I think this is something problem with the food pipe.
Yes, yes. Let me draw for you. This is our food pipe, and this is food bag, which we call a stomach, and this is our food
Sure.
pipe. Yes,
Uh-huh.
normally there is no acid coming back from our stomach to the lower end of the food pipe. But in your
Uh-huh.
condition, Mr. Peter, actually there is a defect in the lower part of your food pipe,
Hmm.
leading to the condition we call reflux. And after many months, actually, the lining of this food pipe can be turned into another lining, which we call Barrett esophagus. And the problem of this condition that it can, I am sorry to tell you, that can turn into a cancerous lesion.
Cancerous lesion? Doctor, what do you mean by cancerous lesion? I don't understand it. What is it?
This
You
is
mean?
yes, it is. It can turn into a nasty growth. I mean,
Hmm.
cancer in the lower part of your esophagus. Although we are not sure exactly if it is cancerous or not, but we have performed for you, as you know, we have taken a snip or a tiny sample from your lower part of your food pipe, and we sent it for examination. But actually, in view of the long standing of your condition, and I understand also that you have lost 4 kilograms, I think, over the last 4 months. Yes, Mr.
Yes.
B?
Yes,
Yes.
doctor, you're right.
We highly suspicions actually that this lesion could be a cancer, Mr. B.
Could
I'm
be
so
a
sorry.
cancer. I mean,
Yes.
you mean that I was having Barrett's esophagus and that result into cancer?
Actually, this is yes. We are. This no. We are not sure till now, but we are suspicious that this lesion
Hmm.
could be a cancer. Actually, Mr. Peter, what we need to do, we already have sent a sample or a tiny piece of this tissue to the lab to examine it and to confirm our diagnosis. But also at the moment, we need from you to put a management plan to confirm our diagnosis and to put you under our close observation. What we need to do is we need to do imaging scan called CT. Have you heard about this before?
No, doctor. We will discuss. I mean, why you want to do this? First, let me know if I was having Barrett's esophagus and
Yeah.
it was supposed to be developed into cancer. Why anybody didn't tell me? Why do
Yes.
people didn't tell me when I
Actually,
came last time?
yes, I appreciate your words, Mr. Peter. And if you let me explain more, actually, normally when the patient comes with Barrett esophagus, and when we discover this, the normal thing is that we should follow up the patient with regular camera test. But in your
Hmm.
condition, actually, we didn't make this, and we admit that this is our mistake, and we apologize that this is our mistake, and you are completely have the right. This is our mistake, but be sure that this was completely unintentional, and we will take certain measure to avoid this from occurrence again. Is that okay for you, Mr. Peter?
Doctor, how? I mean, you just said now you're sorry and now you apologize. How can you? I mean,
Yes,
you
I
put me on
understand.
a risk of cancer. So, if suppose if you have done camera test before,
Yes.
should I have escaped from cancer?
No, a camera test can only discover or early detect the cancer, but cannot prevent it. When we detect it early, we can treat it and we can cure it. And actually, in your condition, we haven't yet confirmed that you have a cancer. We are still not sure, but there is a possibility. And even if you have cancer or not, it is our mistake that you didn't make the follow-up camera test. This is our mistake. But I like to assure you that now we are going to send, have sent the sample to be examined in the lab, and we need to do. We have also written an incident report to the consultant in charge and nurse in charge, and we will discuss this in the next meeting to avoid this from occurrence again. And be sure that this was completely unintentional. I am so sorry for that, and please accept our apology on the behalf of the medical team. Is that okay for you, Mr. Peter?
No, doctor, it is really not okay. I'm so much now shocked. I mean, you could have escaped. I should have known it. You should have told me. So I want to complain, doctor.
Right,
I will complain.
right, yeah, yeah. This is your complete right, and I accept this, and I can guide you to the patient advisory and the liaison service, and be sure that will not affect at all your care, and you will receive the total care regardless your complaint. And be sure also that this is not what was not intentional at all. It was just an intentional mistake, and we have taken all measures to prevent this from occurrence again. Is that okay for you, Mr. Peter?
Okay, doctor, but please let me know the name of the doctor who forgot to
Yeah.
tell me. I will
Uh,
specifically complain against him.
I acknowledge your words, Mr. Peter, actually, but here we are acting as one team, and no one specific one is responsible. We are whole as a professional team, and we admit this is our mistake, and I apologize on the whole of the
Oh
whole
my
of the team.
God, doctor, I mean, now I'm
But
so
actually,
depressed.
I'm
I'm
not a
shocked.
position. Yes, yes, I am so
Mm,
sorry for that, Mr. But let me explain for you more about what we need to do in the future plan for you
mm.
to
Sure,
control
sure.
this. First, we need to get sure that you have this or to rule it out, because at the moment we are not sure that you have this condition. So as I told you, we have sent already a snip of a tiny piece of your food gullet to the lab to examine it. The second thing we need to do, Mr. Peter, are you following me, Mr. Peter?
Yeah, I'm getting you.
We need to an imaging scan called CT on your chest and your tummy. Is that okay for you?
Why you want to do this, CT doctor? Because
Yes, yes. I appreciate your concern, Mr. Peter. This actually to determine and to see the extent of your disease. If there is any, I am sorry to tell you, if there is any spread to your lung or your to your liver. It's just a preventive measure to assess exactly where your disease has been extended. But till now, as I told you, we are not sure that you have cancer.
so,
Are you
doctor, why are you doing this, CT if you're not sure this is cancer? And you why don't if then why
following?
are you worried about the spread?
Yes, yes, I appreciate your concern because if the result comes back from the lab that you have cancer esophagus, which is a possibility, then if there is no spread in your lungs and no spread in your tummy, we can go for surgery and we can invite or involve the surgeon to remove this nasty growth. Are you following me, Mr. Peter? Because time is very essential in your condition.
Hmm.
Yes, but as I told you, this is until now it is not sure that you have the cancer. We are still need to confirm this, but to do this imaging scan just as an early process to be ready if there is any further management step, if we need surgery, we get sure that you have no spread of your cancer. Are you getting me, Mr. Peter?
Okay, okay, doctor. I'm really shocked and worried. I'm so depressed. But
Yes.
definitely, you now seem to be quite sympathetic. So
I,
okay,
I,
I will go for it.
I can only imagine your worries, Mr. Peter, and as I told you, I apologize on behalf
Thank you,
of the
doctor.
whole team, and be sure that we are here to support you and to give you the best medical treatment, and be sure that the non or the delay in your diagnosis and non-performing the surveillance or follow-up camera test was our mistake, and be sure that this will not be happen again as we have taken already the steps to prevent this, and this was completely unintentional. Is that okay for you,
Thank
Mr.
you.
Peter?
Thank you, doctor.
Thank you,
Thank you,
Mr.
doctor.
Peter. Mr. Peter, can I ask you some question, please?
Yeah, sure, doctor.
With whom do you live at your home?
Yes, doctor. I live with my family. I mean, with my
Yes,
wife and two kids.
yes. And all of you are okay and supported? No support needed.
No, doctor. They all
Okay.
are with me. Yeah.
Yes, yes, yes. And what do you do for a living, Mr. Peter?
Well, I work in a factory as a manager.
Yes, manager. No contact with chemicals or something like that.
No, no, doctor.
Okay,
But
and
my job is managerial.
yes, yes. What about your? Do you smoke or drink alcohol, Mr. Peter?
Yes, I smoked 10 cigarettes for the last. We have 2 more minutes. 10
Yes.
cigarettes from the last 10 years, and I
And
do take alcohol
are
on
you still
weekends.
still smoking, Mr. Peter?
Yes, doctor. I'm
I,
smoking
I
10
highly
cigarettes per day.
advise you to stop smoking because smoking worsens your condition. And if you don't mind, I can refer you to the smoking cessation clinic. They can help you as this regard. Is that okay for you?
Okay, okay. Thank you, doctor.
Mr. Peter, also we will need your consent to sign a consent to do the CT, especially if we use a dye with it. So we need to consent and we will need to perform some blood tests to get sure that you are fit for the, especially for your kidney function. Is that okay for you? I will leave the consent for you. Think about it, and if you agree to do the CT scan, just let me know. Is that okay for you?
Okay, doctor. Fine.
Yes, Mr. Peter, how much did you get from our discussion today?
Well, you told me that it was your error,
Yes,
your mistake. That is why my condition, known as the Barrett's something. So it could have, you could have saved me, but you did a mistake and you didn't do camera test. So
yes,
that is why I just I'm suspicious. We are suspicious now that I may have cancer.
yes,
So you
yes,
will do CT scan. Yeah.
yes. And do you have any other concern, Mr. Peter?
No, doctor.
Yes, yes, yes. And again, I apologize on behalf of the team, and be sure that we are here to support you, and this will not happen again, Mr. Peter. Is that okay for Mr. Peter?
Okay, doctor.
Okay, okay. Mr. Peter, do you have any other concern?
No, doctor.
I will just give you some brochures, leaflet, and website regarding your condition, Barrett esophagus, and if you need anything, and my hospital contact number. If you need anything, just let me know. Is that okay for you?
Oh, okay, doctor.
Any other concern, Mr. Peter?
No, doctor. Thank you very much.
Okay, thank you, Mr. Peter. Thank you.
So your time finishes. Okay, doctor. Very good performance. Excellent performance, I should say. So, can you please? You need 1 minute to think, or can we discuss
No, we can
both
discuss.
parts?
We can discuss.
Okay, doctor. So
Yes.
yes. So may I know that what this scenario was about?
This scenario actually about Mr. Peter, 57 years old, who has been not make surveillance for him by endoscope as he has Barrett esophagus, and this was our mistake. I tried to apologize to him, and he comes with hematemesis. We stop this hematemesis, and now we need to confirm that he have a cancer esophagus or not, and to assess the spread if he has mets to the lung and to the liver, of not to see the probability if he has a cancer esophagus.
Okay. So what are the legal, ethical issues?
Ethical or legal?
Both. You can tell first ethical
The
and
ethical
legal.
issue here, the first one is the duty of candor. We should apologize for the non-surveillance by endoscope for this patient. So the duty of candor, we should admit that this is our mistake and be honest with the patient and open, and take action to prevent this from occurrence again. The second thing is beneficence, making good for the patient. Now stop the bleeding by the endoscope and taking a biopsy for analysis, and C2 for the assist the mets presence. And certain non-maleficence to avoid any harm of the patient. Avoid if there is dye in the with the CT, we need to assess the renal function to avoid any harm from the dye with the CT. And justice is treating all patients, dealing with all patients regardless their sex or age or ethnicity. Regarding the legal issue here, first is the consent for doing the CT, especially if it is with the dye. And second, patient has the capacity and also confidentiality of the patient, and the complaint if you want to make a complaint, and yes, this is the legal issue.
An incident report.
Yes, and the incident report. Yes.
Yeah. So thank you very much, Dr. Ahmed. Thank you very much for your performance. It was really very good.
Thank you.
So I have just, I have rather no comments about this performance. It was an excellent performance, but few things definitely we can work on.
Yes.
You used few jargons, like you said, cancerous spleen, esophagus, but then you explained, you corrected yourself, so it is okay. Few jargons we can definitely tolerate. Then you were going through very good, but you didn't touch this error yourself. Rather, I gave you a hint. Surrogate gave you a hint that let us discuss this error issue. Please don't forget that this is the error, because it is very clearly written in the scenario that no one guided him about the need of future endoscopy. So you have to admit, and rather this is duty of candor at this stage, that even if the patient is unaware that you did a mistake, you still have to tell. So I think this was, because if in real exam the surrogate will not give you hint, maybe you will go other way and you will start explaining CT scan and all these things. So please take care of it. And you very rightly explained the steps in error. You have the very good concept about it. And you denied to tell the name of the colleague. That is very good. You touch smoking, alcohol, everything, consent for CT scan, and you were very apologizing a lot. It is good. But when he asked you specifically that why are you doing CT scan if you are not sure, you definitely told it very accurately, very rightly. But you can say that, well, as you know, to just give him an idea that you are now more worried about him, you can tell him that, well, to save time, we want now that no further delay in treatment should occur. If at all the things come bad, if at all you have cancer, we don't want any delay. And as you told that it will help in the management plan, and you can also add on at this stage to show more sympathy that you will personally go and get an appointment, or you will personally contact the radiology team. It can add more sympathy on your approach. Your approach is good, but if you any error, whenever there is error, please tell to the patient that now you will personally follow him up. Like if there is lost report, if there is anything like allergic reactions, so you can mention to the patient that now onward, I will personally take care of your record and I will personally follow your case. So it can add more sympathy. Second thing is, you had time, but I mean, you should have touched how CT scan is done. Because whenever there is a procedure or investigation in the scenario, we have to explain it like this patient has Barrett's esophagus. So you did very good. You didn't imagine, or you did not imagine that he is knowing everything about Barrett's. You explained Barrett's to him again. So same you should have done with the CT scan, that it is a donut-shaped machine, and you have to lie down on a couch, and it will take multiple images, and the images will be viewed on camera. And I mean, few sentences about CT scan were very important, which you would have added.
Okay.
And in this scenario, because I don't think so, anyone else needed, because nowadays this is a typical approach which was very popular a couple of years ago. But nowadays, because of the patient confidentiality, we don't normally, this trend is vanishing. This trend is finishing to ask for any other body present during the discussion. You can use this sentence when you break a bad news and patient starts crying or weeping during the discussion, not in the beginning of discussion. When he starts crying or shouting or weeping, you may give him tissue and ask, do you want anybody else to call? Do you want anyone? Because not in the beginning. Nowadays, not in the beginning.
Okay.
Second thing is, please, in the breaking bad news scenarios and in the error scenarios, sorry, please do not recap. I mean, please do not ask the patient to recap in the breaking bad news scenario and in the medical error scenario. Uh, because the logic being that in the breaking bad, in the error scenario, when you will ask him to recap, he will start again shouting again. He will remember what you have done. He will forget what you have told now, and he will start shouting again, and he will waste all your hard work of 14 minutes. So it is better not to recap in the breaking bad news or in the error scenarios.
I mean, doctor,
So
even if a procedure needed as the CT or further endoscope or something like that, no need also to ask him again.
no, I'm just telling you that in only two scenarios, breaking bad news scenarios, if somebody has cancer, somebody is newly diagnosed with cancer, or if you have any mistake,
Yes.
in these two scenarios, please don't ask to recap. But if the scenario is about investigation, if the scenario is about disease explanation, is the scenario if the scenario is about any other condition, you can recap. But if there is breaking bad news and if there is medical error, by the way, they were both in this scenario. So in these scenarios, please don't recap.
Okay.
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 And one more thing, I this is my perception. Maybe I'm wrong, but you seem to be because this was a lengthy scenario. Maybe it was a very lengthy scenario, and you have to cover many aspects. So you are a bit in more hurry. You didn't give um, much time, but it is justified because the scenario is very lengthy, and you
Yes.
have to cover two topics. First, you have to break the news, then you have to tell the further management plan. You should have involved oncologist that you will, if needed, we will call oncologist and radiologist. See, and second thing is about your this legal issues. So duty of condor is not a legal issue here. I mean, duty of condor is not an ethical issue here. It is a legal issue here. Duty of condor will become a legal issue whenever there is error. This duty of condor becomes legal. We have to tell him.
Okay.
Okay. So in error scenarios, this duty of condor is legal issue,
Okay.
and rest of it is fine. Justice you very rightly mentioned to the patient that even he complains against us, still we will treat him. Autonomy, you forgot to tell me in ethical issues, autonomy. Okay. And the rest was fine. So it was a very good performance, and you were very ready for your exam, and good luck.
Thank you.
So these are the okay. So let us have a brief discussion about this scenario? So that
Again?
just a brief discussion, then we can
Yes.
finish our meeting. So, as Dr. Ahmed told that this was a very scenario of error. So I just want to repeat the steps we need to do in error. So whenever we do an error, first of all, we have to admit that, well, we did an error. Okay. So whenever there is error, you have to admit, yes, that we did an error. Even if the patient is not knowing that you have done error, still you have to admit. It will be duty of candor. Okay. Then you have to tell, apologize definitely that we are sorry for it, and please use the word we, our we. Don't use I, or if you use I, you can say I am sorry on the behalf of the whole team. Then please tell him that it was unintentional. Most of the errors in exam are unintentional, because intentional error means some other scenarios. So, but mostly you should tell that I want to assure you that it was unintentional. Then you have to tell him the steps you took to rectify or to correct that error. So, is my voice clear?
Yes.
Sir, getting cut a little bit in the middle.
Okay, I'm sorry, because maybe the network problem, but okay. So I will just fix the mic. Okay. So then you have to tell the steps, like what steps you took to rectify that error. For example, if you have given penicillin to an allergic patient, you have to tell that, well, now we have stopped penicillin as soon as we came to know, and we have given some other medicine to help him come out of the allergic reaction. You have to do this. Admit, apologize, and unintentional corrective measures, and you have to inform your consultant that this error has happened, and then you have to write down an incident report. All these 6-7 steps you have to tell in any error case, and rest is patient advisory liaison services. So these are special services. They have special office in every hospital in UK where they deal with the complaints. So, they usually patient usually complains to them, and they then do investigations and all these things. One more thing, Dr. Ahmed, you can tell to the patient, this is morbidity and mortality team.
What?
Morbidity and mortality team.
Okay.
So this is a team basically. This is not a, team to investigate the error. This is a team which is basically looking about different problems faced by the patient, or different problems faced by the relatives. So this can have different names. But basically it is dealing with the morbidities and mortalities. Why they have, and try to, and they meet, and they have weekly meetings in the wards. So you can tell to the patient that we have this team of highly senior consultants. We are meeting weekly or fortnightly to look into these errors and all these things. So we will discuss your case in the meeting also, so that we can rectify ourselves, and these mistakes should not happen in future. Okay, morbidity and mortality team. Rest is, and if definitely he asks you to please tell me the name, you are not supposed to tell the name. you will say that definitely we work as a team. So, and you have to again explain a bit about CT scan. That CT scan is a donut-shaped machine, and it is you will have to lie down on your couch and on a couch very still, and it will take. It is an OPD procedure. You have no need to get admission, and it will take multiple images of your body to see what is going inside. I mean, if there is any cancer or any growth, anything like this. Okay. So the patient concern will be this few, like why you didn't do camera test, uh, you put me on a risk of cancer, and now you are, and definitely, Dr. Ahmed, one thing you can tell, if you have time, but since you didn't touch CT scan, whenever you have investigation, you have to tell about the complication of investigation. Like CT scan will put you on excessive radiation, so it can increase risk of cancer sometimes. In exam, whenever we put patient on radiation, we should not forget increase risk of cancer, but we have to tell that the knowledge or the info which we will get from the CT scan is much important and is very much more than the negligible risk of cancer. We will do like this.
Okay.
Okay. So these are the few things. Difference between Dr. Shaheen, difference between error and mistake. Technically speaking, if we see for exam purpose, there's no difference between error and mistake. Okay, and please, this is very important. I just remember, please use the word error. Don't tell to the patient that we did mistake, because normally the concept is that error occur unintentionally, and mistakes people are forgetting or something like this. So it is preferably to say error. And one more sentence you can remember that if the patient is more angry, so you can say that, well, Mr. Peter, I'm really sorry, but errors do occur in even very highly specialized centers. We are very trained, we are very qualified team, and we follow the protocols, national and international guidelines. But I really am sorry to tell you that errors do happen even in very specialized centers. And this is a scenario of million times apologizing, and your face and your body language should show to the patient that now you are sorry and you are sympathetic. And you can, whenever there is error, you can tell the patient that from now onward, I will personally take care of your case, and I will make sure that you get appointment as soon as possible. And I will personally contact my colleagues, which are the radiologists. And whenever there is error, please don't forget to mention incident report, complaint process, in the and duty of condor in the legal issues. Rest is same. And in the ethical issues, whenever there is error, justice will come on the top. That even he complains against us, even then he is our patient, and we are supposed to treat him, and we will not be biased because of the complaint he has made against us. Duty of condor can be both ethical and legal, but whenever there is error, it becomes the legal duty of doctor to tell the patient what has been done, what error has been taken. So, by the way, duty of condor means that we have to tell the patient truth in any situation. Even he is going to complain against us, even still we are going to tell him. One more thing I would like to tell you in error scenarios, that whenever there is mistake or error by a doctor in UK, they don't fire him. I mean, the doctor who did error most commonly, unintentional error, he is not fired. Rather, He's referred for some further trainings or referred for some capacity development. So the patient may ask you that I want that doctor to be fired. So you should tell him that we don't fire anyone, but we will definitely do more capacity development and we will improve our skills so that it may not happen in the future. So I think it was an excellent performance, and I have no further comment. If anyone has any question,
Sir, yes,
please.
sir. Sir, CT scan in this scenario, it's not written that it will be contrast or plain. In that case, we will advise patient about any allergy to contrast and renal function as he asked.
Yeah, because at the moment we are not sure. So I will suggest that you can add on that if we need to inject a dye, so for that we will check your kidney functions. But whenever there is CT scan, you should keep the possibility of contrast. So
Right.
you should say that if at all we needed to put a dye, then for that reason we have to put to check the kidney function.
And sir, autonomy applies here. That patient has right to refuse CT or accept.
Yes, definitely. All ethical principles like autonomy.
Yes, sir. So he didn't mention. Actually, I didn't hear it. Autonomy.
Yes.
Okay.
He forgot
Okay,
to mention autonomy.
Okay, sir.
But the most important is justice, because
Yes.
it will come on the top. Yes. So this was a brief scenario of today. So if there is no question, we can end the meeting. Okay. So
thank you, Dr. Tanzeel.
Thank you very much for joining. Thank you very much, Dr. Madhu, for joining. Today is Tuesday, so we will have next session on Saturday, hopefully.